If you've tried everything for your L4-5 or L5-S1 disc bulge or disc herniation and you're still struggling with crippling back or leg pain, there's a good chance you're missing one or maybe all of these critical 7 non-surgical treatment steps. This is the exact 7-step method I've used for years to help thousands of patients get their lives back from disc bulges and herniations. I know it works, and one of these steps is so unique because it combines 2 research-backed treatment modalities at the same time for maximum healing effect. In this video, I'll break down each of these 7 steps in detail so you'll walk away with a clear plan for permanent relief and know exactly what to ask your doctor if you're missing a crucial piece. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. I upload a new video every week. In addition to that, I've created a free health vault. It's a collection of exclusive videos that gets delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it in the link in the comment below. Before we even begin the 7-step treatment protocol, we start with an in-depth consultation and examination, including full spine digital x-rays, a full spine nerve scan, and a full review of any MRIs or medical reports that you bring in. This isn't just a preliminary check, it's actually the most crucial step in the entire process, and it's often the most overlooked or mishandled in most standard care. Why is it so important? Because to effectively treat an L4-5 or L5-S1 disc bulge or herniation, we need to understand all of the factors contributing to the issue. A disc bulge doesn't just happen in isolation. A disc bulge is one that can be caused by a combination of mechanical imbalances, muscle weaknesses, nerve impingements, or lifestyle factors for sure. By taking the time up front, we identify each contributing cause so that every step in the non-surgical treatment is perfectly tailored to address and correct the root issues. This thorough diagnosis not only ensures that treatment protocol is customized, but also helps prevent any missed details that could slow down or even prevent your recovery. With this careful groundwork, we're setting you up for maximum success and truly lasting relief. Step number 1 is really at the heart of our program. It's what we call non-surgical robotic laser spinal decompression. This is an amazing new revolutionary invention where we've taken 2 well-known science-based technologies and we've combined them. So you had 2 really smart Canadian doctors. Number 1, Dr. Alan Dyer, PhD, MD, former Minister of Health for Ontario, who invented spinal decompression. Then you've had another Canadian doctor, Dr. Mark Jagger, who then combined class 4 laser with spinal decompression at the exact same time. By doing so, we're getting results that people have never seen before. The class 4 laser does a number of different things, but ultimately the 2 big things it does is it's going to actually ease up the muscles while the spinal decompression is happening so that your body does not resist against the movement. And number 2, people have done a lot of damage to those areas in there. So a class 4 laser, highest level of laser approved by Health Canada and the FDA, is going to help to heal that damage as well. Everything from increasing blood flow, decreasing inflammation, increasing nerve and cell regeneration as well. So that's the beautiful thing about non-surgical robotic laser spinal decompression. We've given thousands of successful treatments on our system right here. It's helped people with advanced degenerative disc disease, with spondylolisthesis, with disc herniations, disc bulges, sciatica, spinal stenosis, failed back surgery, and the success rates are fantastic compared to what else is out there, with none of the side effects that are normally seen in surgery or drugs or some of the other treatment methods that occur. Very simply, you've got pressure on the nerve and pressure on the disc, and you've got a disc that's rehydrated. What on earth makes more sense than to take the pressure off the nerve, the pressure off the disc, and to then rehydrate that disc as well? And that's what we get with non-surgical robotic laser spinal decompression. Number 2 on our list is what we refer to as neuromuscular re-education. So understand, this is not just going out and doing the top 3 exercises to strengthen your core. I'm a big fan of core strengthening. We don't do that when there are multiple disc herniations and bulges. We don't want to put more pressure on something that already has too much pressure. I've worked with some of the very best athletes in the world. Things have to be specific to you at their appropriate place and time. So what neuromuscular re-education is most people have been living with this for so long that their brain has lost the ability to send the right messages to these muscles to work in the order contraction that they should. So this is something step by step. We hold you by the hand through this, that we literally have to get your brain to start working these muscles again in the appropriate manner. Most people have this basically have developed what we call faulty movement patterns. When you've been dealing with things that have been out of whack for a long period of time, your body's going to compensate. It's trying to make the best of a bad situation. We need to retrain your brain on how to bring that back to normal again. Step number 3 is of significant importance. It's what we call our disc replenishment and healing protocols. So that's great that we're trying to get the body to heal. We want the tissues to heal. We want the nerves to heal. We want the joints to heal. But if we are not giving them the nutrients that actually are required for that healing, we're going to be fighting an uphill battle. Again, that's going to be individualized to depending what's going on with you. But they may include things such as acute 1. So this is from Core Science. This is easily one of the most advanced natural anti-inflammatories on the market. But depending on how it's used, it can also actually help to eliminate some of the scar tissue in the body and actually clear some of that. We may put you on, again, a Core Science product, OA Max. This is specific to start to rebuild that disc and cartilage, especially for people where that disc is weakened either through disc herniations or especially in degenerative disc disease. And what a lot of people are never told is the body can produce these nutrients up to about age 40, give or take a year. So if we're not replenishing those back in, we'll never maximize healing. It could be, again, of course, Science Nerve Regen Max. So in all of these conditions, whether it's the sciatica, the disc herniations, the disc bulges, the stenosis, we're actually affecting, we're degrading nerve and in fact even spinal cord. A Nerve Gen Max has actually been shown to help to give the body the energy it needs to start to regenerate those nerve cells and tissues. It could be a Mag 7. Now, again, this is important because there are multiple different forms of magnesium out there. Mag 7 is a specially formulated, one-of-a-kind formula that's been designed specifically for my patients, where it has 7 different forms of magnesium. Some are better for muscle, some are better for nerves, some are better for blood pressure, some are better for sleep. This has one of the only forms, magnesium threonate, that's actually been shown to cross the blood-brain barrier. It could be simply electrolyte balance. Most people, unfortunately, their electrolytes are way out of whack, and if it's something we can help restore that, remember your muscles require proper electrolyte balance for proper healing. Again, all these are specific to you at their appropriate place and time, again, all based on what we find in our initial comprehensive consultation and examination, but they're a critical step of our 7-step method. Number 4 is what we refer to as neurofunctional spinal correction. So what this is understand most people, whether it's disc herniations, bulges, but certainly sciatica, stenosis, spondylolisthesis, all the other back issues as well, the vertebrae become misaligned. So it's these spinal misalignments that not only put pressure on the disc, will throw the muscles out of whack and cause pain, will limit movement, but the biggest thing will do is they will then start to interfere with that nerve. Neurofunctional spinal restoration is the process of literally restoring that back to the method, to the position and the movement and the function that it should be. So as a neurofunctional chiropractor, I don't just want normal alignment. I want to restore movement, I want to restore function, and especially I want to restore nerve function. Until you do that, the brain will never be sending the right messages throughout the rest of the body. This is key, one more key part of our 7-step process. Number 5 is what we call muscle tissue restoration. So what's happening is when these have been out of whack for, again, as long as they have, you will develop adhesion and scar tissue in the musculature and all the soft tissue. If we don't restore that back to the way it should be, you can try all the stretching in the world, but how effective do you think it is to stretch a muscle that's scarred or adhesed? You can try to restore a normal movement, but if that's affected by muscles that aren't working properly. So this is not simply throwing on an ultrasound or an electrical current. This is something we want to restore your muscles to function the way they should. Once again, that's something called muscle tissue restoration. There are a number of different techniques. I'm a big fan of active release techniques, ART as one of those, but there are a number of techniques we do to restore muscle function combined with restoring nerve and joint function all at the same time. Number 6 on our list of protocols in our 7-step method is lifestyle factors. If you are someone who spends 18 hours a day in front of your desk or computer in postures that just aren't good for yourself, if you are someone who is all day on the farm baling hay, if you're someone who doesn't know how to lift properly, understand it's your lifestyle is a big reason why you're in the position that you are right now. We need to teach you how to correct all these things so that you don't aggravate it so much in the first place. And then that brings us to step number 7, is we do progress exams on all of our patients. Our program is not a let's cross our fingers and hope. It's not, well, I hope this one works this time. Is all the tests that we did, from the full spine nerve scan to the high frequency digital x-rays to all the orthopedic tests, the review of the MRIs, we look at all, that's a baseline. And then when you get to when you've completed your program, we want to redo those exact same tests again to show that we actually have the functional improvements that we want, and not only to show that we've actually improved, but also to know where to go from there so that you can maintain that improvement and you continue that progress as well. And part of that is also the fact that all of our programs are individualized to you. No one is on the exact same program. There will be different forms of neuromuscular reeducation depending on where you're at. There will be different neurofunctional restoration. There will be different types of muscle tissue restoration. There are different nutraceuticals depending on what it is that you need. Even with the non-surgical robotic laser spinal decompression, you could go to one of the other 11 clinics in the world that has a system and you may get a different experience, because that's up to me to set what we call the technical factors. So that's what amount of laser intensity, what robotic pattern do I want you on, what amount of spinal decompression tension are we going to put you through, what are the time intervals. All of these things will determine your recovery, how your body responds, and how we get you back to finally living the life you deserve again. It's this comprehensive, integrative, multimodal approach that has allowed us to successfully treat thousands of patients, helping them reclaim their lives and live pain-free once again. Take Connor, who'd been struggling with significant low back pain due to multiple disc herniations for years that made it next to impossible even to work. After going through this precise 7-step treatment method, he's back to work pain-free. And then there's Andrea, who couldn't even walk due to the intense pain from her disc herniation. But after completing this treatment, she's not only pain-free, but back to hiking, something she once thought was impossible. These stories and many more are proof that this approach works. Through careful diagnosis and a dedicated multimodal plan, we're not just treating symptoms, but helping people return to the lives they love. So please don't give up. No matter where you are on your healing journey, there is hope. Just like Connor and Andrea, you can get your life back. If you feel that any of these 7 steps are missing from your current treatment, don't hesitate to discuss it with your doctor or therapist. Each step could make a difference. Now I want to hear from you. Share your story in the comments below. What's helped bring you relief for your back and leg pain, or what treatments haven't worked for you? Let's learn from each other. If you found this video valuable and gained new insights into treating an L4-5 or L5-S1 disc bulge, please like it and share the video to help others on their journey to be pain-free. And don't forget to subscribe if you're looking for more proven tips and strategies to treat and relieve debilitating back and neck pain without relying on drugs or surgery. The next video you should watch is this one right here: 5 easy-to-do exercises for quick L4-5 disc herniation relief. You can see some of the exercises that I teach my patients in the 7-step treatment process. Go watch this video next.